Hey, deserving listeners, this is a trailer for the member exclusive video that I am going to post for members in which I watch couples therapy. So if you're watching this and you're not a member, you can become a member by clicking the join button, or there's a link below in the description as well. And you can see this whole video and also all the other videos that I'm going to be posting for members in which I watch couples therapy. But every week I'll be posting a little free bit of every episode. So let's watch. My name is Dr. Kirk Honda. I'm a therapist and a professor. As I always say, don't use YouTube as a replacement for therapy. If you need a therapist, get one. You deserve it. Let's watch. Is this the couple that I'm supposed to be watching? I feel like I've been yammering and yet we haven't even gotten to, what's it, Sean and Erica? Hello.
Hello.
Okay, I just saw that she has a little dog. Looks like a super cute dog. I don't even know what kind of dog. It looks like a little husky. Doesn't look like a puppy. Just looks like a tiny little miniature husky. So let me talk about this. There is a form of therapy that uses animals, pets, horses, these kinds of elements, and they are wonderful modes of therapy. And it requires expertise on behalf of the therapist, which means training and consultation and other kinds of things, and ethical codes that you have to add on to your practice. It also involves disclosing that to your clients. You have to tell your clients up front, by the way, I have a dog, a free roaming dog. Here's a picture. She's pretty nice, and normally she just sort of curls up next to you. And if you want to pet the dog, there's a disclosure, because you need to give clients a heads up before they hire you, because for some people, they might not want that, whereas others, they might want that. They might hear that and say, oh, I had 5 therapists on my list, but you're the only one that has a dog. I'm definitely going to hire you. It's important that you advertise that. And, the same would be as if you use horses in therapy. Now, of course, you don't bring a horse into the therapy office. You go to the horses, but there's a lot of powerful work with veterans and trauma, and really any client can potentially benefit from that. So, it's not just the horse being there. There's a whole procedure. There's a lot of research around it. Dogs are the same way, cats, other kinds of animals. Yet, what I see is I see a lot of therapists that just learn that it's okay to bring your pet to work, and it's easier that way because they don't have to worry about their dog being at home by themselves or whatever. And they just bring their animal into the therapy office. Now, if you know me, you know that I love dogs and cats. I love dogs and I love cats. So obviously, I'm all for it. And as a client, I have mixed feelings, though. If I go to a friend's house and they have a cat or a dog, I'm the one down there. I'm one of those people. I'm the only one. So I'm one of those people. But when I go to therapy, and it's a pain in the ass. It's a lot of money. I'm driving down there. I got to park. It's hard to find the therapist to begin with. I don't want to be distracted with that preference. I sit down on the therapy couch, and my preference is to play with the dog. That could be 20 minutes of me wait, or I don't know, or at least my attention is sort of drawn, and that I believe is wasting my time. And if a therapist told me up front, look, by the way, I have a dog, and I was like, oh, well, but I really want to work with this therapist, then okay. But what I see a lot of people do, therapists, is they don't tell people up front. And maybe even 30 sessions in, suddenly the dog is showing up. And there's no viable way for a client to be able to, because what therapists will say is they'll say, well, I asked all my clients if it was okay. What client is going to say at that point, no, don't bring your dog into, put your dog back in your car? No client is going to say that, or very few clients are going to feel safe enough to say such a thing. So it all just has to be done by the book. I'm a very firm believer in what they call, psychoanalysts actually invented this term, the frame of therapy, the structure of therapy. It doesn't have to be rigid necessarily, but you have to disclose it, and you have to be thoughtful. You have to be careful. And I don't know, it's a trend that I see that is worrisome. I worry about clients, and I also worry about our profession. Are we professionals, Or are we just like people that chat? Okay, so we finally arrived at Sean and Erica. I'm curious why all y'all voted for Sean and Erica for me to watch. Let's watch. So 8 years married.
My marriage, my life, my family, I'm probably like 80-20. 80-20 that my family is awesome. I love my family. It's everything that I want. And then there's a 20% that is this funk. There's some stuff that we need to work on, right?
Okay, so I'm going to actually be taking notes. She just said that she's 20% dissatisfied with her family.
I, for whatever reason, tend to focus on the 20%. So what I definitely need help with is getting out of that 20% space.
She believes she is focusing on the negative. And by the way, this sort of reflects what I do. I take a lot of notes in the first 3 to 5 sessions because a lot of information is happening. By session 50 or 150, I know the client pretty well. I don't need to take notes or to look at my notes. But in the beginning, especially when you have a full practice and you're seeing 30 clients a week, because you see the client for an hour and really it's 50, 55 minutes. A lot of information is happening. I'm keeping notes. And then as soon as the hour is over, it's say goodbye, brand new client, and then client, weekend, relax, client. And then all of a sudden they're in my office again. Wait, what? So I have a lot of notes from that first session that I can look at for the 5 minutes before session, reorient myself. So maybe it's helpful to kind of show that. One of the questions I had, because a lot of people, y'all, have been wanting me to watch this show for years. I watched a little bit of it in the beginning, Annie and Mao, I think it was his name. And a lot of people were like, hey, you gotta watch couples therapy. Please watch couples therapy again. And I always wondered why, because it's so dry and clinical. All right, well, that does it for the trailer for this episode. If you want to see the rest of this episode and all the other episodes in which I watch this show, you can become a member of the YouTube channel by clicking below. Otherwise, please take care of yourself because you deserve it. You really, really do.